Okay, so we are here for our referred pain pattern and trigger point self-care class. And I have the beautiful Kayla here with me. And some others that are waving at us in the class. So I am going to try to get through a couple of things before our time is up. So before we start, I just wanted to ask anybody here, is there anything in particular that you want to know more about in regards to self-care and referred pain?
I'm not to hurt myself when I kick.
Okay.
Because I do that a lot, apparently.
Well, that's okay. So, anybody? No? Okay. All right, well.
There's a better term for it, yeah.
I guess the first thing we're going to do is talk about pain. Okay, so what is your definition of pain? How do you guys see pain?
Not all
painful.
Painful.
A tool to help me figure out what's wrong.
Very good. Okay, Jenny?
Pain is actually, people hate it.
Yeah.
But it's really important because I know a lady that did not have pain receptors, and she had to be extremely careful when she was pregnant because she didn't know when she was in labor. So she had to use other senses. So we're given pain to tell us something is wrong.
Absolutely.
And that's the same thing with leprosy. Mm-hmm. They don't have pain receptors.
I didn't know that.
Yeah, so that's why, they burn themselves. Mm-hmm. Like in the old days, they would walk into the fires and so forth. They felt no pain, and yet it would do a lot of damage. So actually, pain is a protector.
It's great. I love your answer. How about you?
The pain.
Pain, okay.
Yes.
So the International Association for the Study of Pain defines pain as, I'm probably going to butcher this, it's a sensory and emotional experience based on a threat or perceived threat. So like you said, it's a way of telling us something, but something's wrong. But it could also be based on the perception that something is wrong, even though something's not wrong. Sensory, physically in the body, and emotionally.
Oh, well, we're definitely going to talk about how pain can affect the emotions and the psychological faculties, a little bit too. So I love these answers. They're amazing, really, because I think a lot of times people don't view pain in the right light. They see it as something that's bad, something that's painful, and so we should just get rid of it. And what do? With a messenger, we don't want to hear the answers. We kill the messenger. So we use pain killing, like your medications, or we'll just try to make ourselves busy, distract ourselves, and that's just not helpful. So,
or we'll think the worst, what medical literature would call catastrophize, which can also add to the pain.
So, yeah,
make it worse.
When we see pain as a messenger, which you guys, I think we're all in agreement on, then we have to look at our bodies as a kingdom, right? Our minds, are ruling this kingdom, and pain is just a messenger telling us something is wrong and that something needs to be done. Now, if a messenger came up to the king and it's like, oh, no, I need to do this, and the king's like, well, you get to make the decisions. They wouldn't do that, right? This is what happens when we're led by our emotional response to pain. We're letting pain dictate how we're going to react, right? So I think of Moses and the scouts. He sends these scouts out to scout the land, right, that they're going to fight. And what was it, eight of the scouts comes back, and they're like, oh, it's terrible, we can't win. Craziness. And then 2 scouts are like, yes, but we can. But what ended up happening is the body listened to this other, to the 8. Yeah, or however many. Is it 8? I think it's 8. Yeah, anyway. So we can do that if we let pain rule us. But if we don't, we can see it as a messenger, figure out what is wrong. There's a verse that says, and I'm going to haggle it, it's the glory of God to conceal a matter and the honor of kings to seek and to investigate the matter, right? So something could be hidden from us, but it's our job to look into it. And pain is that messenger. It tells us something behind the scenes is wrong, and we need to figure out what it is, not just kill the messenger. So, do you guys have any questions about what I'm saying there, or any disagreements?
I have a statement. I realized what you said, and I thought, man, I look at my hand, and it's like, and I'm like, I'm the boss, though, and then I stick it in the fire.
Well, you could do that.
Kill the messenger. I don't need a hand. It was just holding me back.
But if you,
And then I regretted it later.
well, you don't have to listen to your pain. And there's people who are in chronic pain that have to say, I know I'm in pain, and I still have to do this. And that's just the fact of nature. There's a lot of people in this room right now that are in pain that still have to function. We still have to get up and we still have to take care of our daily lives and push through, right? We can all agree on that, okay? So you didn't really kill the messenger if you did that. Killing the messenger would be like, I'm not listening to you. I'm not even going to acknowledge that you exist. You're dead to me,
I
right?
still got 2 hands, so I guess not.
Okay, yeah, exactly. But I see what you're saying. Yes, you can do that. You
Or
can.
medicine.
What's that?
Or medicine, ibuprofen and stuff.
Exactly. And there's a time and a place for painkillers. But to use them to completely disregard where the origin of disease is not helpful to your entire body because you're not listening to something very important. And we're going to talk about that with referred pain because that's the next thing we're going to talk about. So, any questions? No? Good stuff, guys. Seriously. All right, so the types of referred pain. I gave you guys all little charts, and I will which one do you guys want to start with? The organ, visceral, or
Probably the dermatome.
dermatome? Okay. So the first chart then is the one that has the, it should say dermatome on the top. And do any of you know what referred pain is? I'm sure you do, but you know what referred pain is, right?
Yeah.
Okay. So referred pain, the origin of the pain, the actual compromised, whatever it is, may not be actually what's hurting. It can be a whole slew of different areas that are actually hurting. And so with the dermatome chart, I'm just giving you that to talk about nerve pain. We're not going to really talk about that today and how to deal with that, but I wanted you to be aware of what that looks like. There's a different kind of pain that goes with nerve pain. I've had nerve pain and it's been very sharp. You can't get away from it. It is awful. It is awful. Kayla, you've had it, right?
Yeah.
And it will also often radiate into the rest of where the nerve goes.
Like the sciatic nerve going down from the hip to the foot.
Yeah, exactly. Or in the neck into the arm, and or going down the arm, and can mimic things like heart attack, and can be very frightening. When you don't know what it is. So that's one kind of referred pain, and another kind is the organ referred pain. And in the organ referred pain, this is really quite fascinating. I'm not sure I completely understand the mechanics of how this works, and I don't really know if they know, to be honest with you. But the mechanism for how this happens, the organ referred pain.
Yeah, I wonder if it has something to do with the enteric nervous system.
Yeah, it could. I just don't. I
It
know.
has its own nervous system.
So is that where the organ visceral referred pain patterns come from? I think it's fascinating on that chart that here, this area here.
Oh, you're referring to the other chart, right?
Oh yes, this is the organ chart. Yeah. Is the diaphragm, right? And when my rib cage was locked up, I would have pain here. And I couldn't understand why. And it was this achy kind of nagging pain. You know what I'm talking about.
Mhm.
Huh?
I do too.
Yeah, okay, so then you can understand that. And it's like no matter what you do, you rub it, nothing makes it any better. Now I don't have that pain. I can breathe deeply, but it was the diaphragm. And or at least I'm assuming it was because dealing with the diaphragm, now there's no issues there. So I think it's a good one to know about because sometimes we think we're in pain, so it's a muscle when it's not a muscle at all, and we need like an actual medical diagnosis really to like because we should not be self-diagnosing our organs in any way, okay? So, but if you know that you're always getting pain in a certain place and nothing seems to help it, this is something you can talk to someone about and look into more of. So, anything to add to that?
I can't think of anything right now.
So because we're a whole body, everything works together, and if one thing gets out of whack, it affects many different things. So if you have spinal issues, whether it's compression or bulging disc or herniated disc, etc., how does that affect the organs? Or is it reversed? If the organ is diseased and has issues, is restricted, does that affect the spinal cord?
That's a really great question. In fact, it reminds me of a modality that we're actually going to put together an exercise thing. We're talking about it. It's in the works, hopefully. But it goes back to a modality that I learned a long time ago called craniosacral fascial therapy. Okay, so it's not just craniosacral, because in craniosacral, I've seen great things happen, but as soon as you get up and move, everything goes back to what it was because the organs, the scar tissue, the muscles pull down on that cerebrospinal apparatus, right? The spine, the skull, everything that attaches. And it can pull it right back out. And so then when the cerebrospinal fluid is not moving properly, then we can see all these other things happening. So I think it could go either way. The body can affect the spinal cord and the spine, as well as the spine can affect these other things. If a nerve isn't functioning properly, that innervates, and we're going to talk about innervation when I get to the online resources, but when a nerve that innervates something is compromised, then everything would be compromised in that. At least that's my understanding. Am I about right with that? You think something like that?
Yeah, when you're looking at the dermatome chart, if you have an injury in the nerve root, then the neuron has an associated path of part of the body that it innervates. You see on the chart, right? So for C7, it goes down a certain part of the arm. If it's injured at the nerve root, you'll see that whole dermatome affected, usually the whole thing, but say it's only part of it. The C7 nerve will eventually branch off into smaller nerves, like I don't think, because there's from the cervical nerves, there's the ulnar and the radial and the musculoskeletal or whatever. So if you don't see the whole dermatome affected, but maybe just part of it, you might not have an injury or compression or whatever at the nerve root, but somewhere down lower. And there's another chart for that, actually. That's the peripheral.
Yeah, I did not print that. But yeah. So.
But as far as the organs affecting going back, you said that's a good question. I don't know.
Well, I'm thinking like, especially like with things like endometriosis, so it's internal, and would that also be pulling on that? Or if you have referred pain from that organ, which then causes a muscle spasm because of the pain, it would. You see how this could? There's so many possibilities, and so it's really an investigation.
So I've been to chiropractors for years. Okay, so basically, I feel like the chiropractor is working on the joints, the spine, and alignment of the skeleton.
Yeah, depending on what all they do. But
Okay.
yeah,
And so then I can't pronounce that word, but that's vascular?
vascular or visceral.
Visceral.
Uh-huh.
So what is that? Is that the organs?
Yeah. So like the inside the thorax, inside your
Abdomen.
rib cage, and then the abdomen, and so all of those things that are all of your non-voluntary organs, I guess, maybe sort of. I don't know exactly how I would define that. We'd have to talk about that later.
Okay.
Yeah.
Visceral organs.
Yes.
So
I'm not
if,
sure.
if you've had injury to your abdominal cavity,
Mhm.
so can that affect your spine? Or
Well,
vice
I'm looking
versa?
at it from like a musculoskeletal and like fascial. I see that it would, especially with the craniosacral fascial therapy that I practice. The fascia, the theory is that the fascia and the connective tissue, the scar tissue that builds up, can then impede the movement of the spine. So I wouldn't, and I'm not a doctor, so I can't say this, but I couldn't see an organ actually reverse, like the organ itself causing an issue, but this cascading effects of the organ failure causing other issues. I mean, because does that make sense? So like if you have like I was telling you about my diaphragm, so then I'm not breathing deeply, so then I'm hyperventilating, which can cause these other things to happen that would then cause other, and it just kind of goes. So if we can catch the pain and the dysfunction when it starts, that's the best prognosis that you can ever have, because you don't have all these other secondary ailments, and because you can fix all the secondary ailments and still have problems because that the origin of the disease is still compromised. And so then it gets really frustrating because then it feels like the ailments are moving around. I have a pain here. I have a pain here. I have, you know what I'm saying? And it just kind of moves. So you fix this and then it comes because it was never really fixed, if that makes sense. At least that's my opinion on persistent, like this changeable kind of symptoms.
So it's like plugging a hole when there's water, right? And then it just comes out somewhere else because you didn't get rid of the water.
Well, yeah, it's gonna find another.
Path of least resistance.
Yeah.
Exactly, it's gonna
Yeah.
until it's like a monkey wrench in a machine. We're a machine. If you really want to look at the body as, and we're gonna talk about this with the anatomy, a series of levers, right? That's all it is. So if you had a car and you took a screw out or added a screw or did something that changed the way it moved, everything's going to have problems. And the longer it goes, the more problems you're going to see. So peeling back an onion, I think, is actually Dr. Gillespie, who taught me the craniosacral fascial technique. He talked about it's like peeling an onion. So we really wanted to focus on working with children because they don't have so many onion layers. The older you get, it's almost palliative care because we can't get through all of the onion layers. It takes time to get back to the origin of it. Unless we can listen to pain and look at pain as a messenger, sometimes we can skip all of the onion layers and go right to it based on listening to the pain. This is why I think pain is very underrated. It can really help us a lot. So, okay, anything?
That's good.
Okay. All right, so now here's what we're actually here for. Muscular myofascial trigger point referred pain. Okay, so I think you guys know what this is. Okay. Alex, do you understand what I am referring to with the trigger point referred pain?
I believe so.
Okay, so basically, you can have a trigger point, but the pain for that muscle might be in completely different areas. Okay, so I'm gonna use myself as an example because this one was really good. I didn't walk for 3 days because I hurt myself trying to work myself out. And when we talk about safety first, we're going to talk about that. So I had some pain in my back, and I didn't have anyone to work on me. This is when I was working, independently. I didn't have somebody that I could ask for help. And so I used a Theracane, and I kept like getting the trigger points that were here, right? Well, actually, it was my rectus abdominis. So even though this muscle was hurting, I was feeling the pain in a completely different area of the body, right? So this is what trigger point referred pain is, what I'm referring to with the referred pain patterns, okay? So do you have any questions about that? Why would the referred pain be like that? Do you have questions? Okay, then I'm just going to go ahead into that. Okay, you have anything?
No, not yet.
All right, so this is important to understand because you could rub. Let's say you have pain here, right? And you could rub your leg all day long, and until you get, because I think that's a referred pain for gluteus minimus. I think until you get into the actual muscle up here, that pain's not going to go away. So then you go to the doctor, you say, I have pain in my leg, and they look at your leg and say your leg is fine, because your leg is fine, because that's where it's actually presenting. And so there's multiple like ideas that you can think about this. Think about it like if we work on if there's an injury in one part of the body, every other part of the body has to compensate for that injury. So if you pull a muscle in your tricep, then your bicep is going to now, because this is shortened, is now going to have to pull. So you might actually have pain here and a latent trigger point here that you didn't even know hurt. And this is what I see a lot is I'll be like, oh, well here, and I can touch you and that will hurt, and you didn't even know it hurt. How many times have we all experienced this?
Mm-hmm.
Yes. Until somebody touches it, you didn't even know it hurt. So we can use the pain patterns to find where the origin is in some cases. And that's helpful for people like, well, everyone here that wants to work on themselves. Maybe you're getting a headache and you don't want to go to the doctor for a headache or take pain medicine. How can you find the origin if it's a tension headache? You know, that's not always what headaches are caused by. Sometimes there's other things, but if we can find that, and then we can save ourselves some unnecessary pain. So, did you have anything to add?
Oh, well, just how you mentioned, that we could look elsewhere for the source of pain if we're not getting any relief. And we talked about teaching somatic awareness to help.
Yeah. So being aware of your body, you have to be able to be aware of your body. Mm-hmm. And what's that?
I was just gonna say, if you have referred pain, will the origin hurt if you touch it or something like that? Will the origin?
Sometimes. Usually,
yeah. Tender.
And it's not always another muscle. Sometimes it's a compromised joint. So, and when we talk about stretching, we can talk about that a little bit too, because it's just about finding why is this muscle referring pain. And so we can look for the antagonist muscle? I can't remember the jargon for the anatomy, but the opposite muscle, right? So if you're trying to find something that extends your leg versus flexes your leg, there's an opposite muscle for each action, or you'd be stuck. Like it wouldn't work. Yeah. So you wouldn't be able to move. And I'm really focusing on the voluntary muscles. And we're not really talking about things that are involuntary referred pain right now. Yeah, that's.
Well, just like I've been to both of you, and I've been to many other people too, and they have hit places I didn't even know hurt.
Right? Yes.
You guys put me off the table.
That's why I think getting a nice full body massage, even if it's just like a Swedish massage to relax, and then just being aware of your body and what hurts, so you can say, why did that hurt? Because if you don't touch it, you wouldn't even know that it was a problem. Right. Yeah. And then, but if we can find the trigger point, then it can tell us what if I find the trigger point before it refers pain, we could stop you from going into that pattern, which is ideal, especially for well, just for everybody. Nobody wants to be in pain, right? Good maintenance. Maintenance is a good word for that. So, so that's kind of, so what's a trigger point? Actually, I had to look up this definition because I just use it so often. I didn't know exactly. Okay. So it's basically like a tender spot in the muscle belly, typically. And oftentimes you can feel a little knot, like, there's a knot in there, right? And then you have active and latent trigger points. Active trigger points hurt all the time. Like you got a spot that just is aching and you can't get it out. And then there's latent ones, and these are the ones that I'm really talking about because they're the ones that you don't feel until you press on them. But you'll feel the referred pain from them. So you don't really, the message of the pain is getting muffled in translation because the origin is not being declared, just that there's something wrong. And this is where we have to investigate a little bit more. So yeah, that's pretty much, the definition of the referred pain for trigger points. So do you have any questions about referred pain right now? Okay. So the next thing I want to talk about, because that's a lot of information, but what are we going to do about it? How do we apply this? And I included on your little agenda 2 resources, and actually I'm going to grab this laptop so I can make the clip. But I'm actually going to demonstrate to you guys what you can do. Because I know a lot of these off the top of my head, but that's not going to help you, right? Are you going to take, go to massage school and learn all this stuff and then take the seat? That's just, it doesn't need to be that way. There's some awesome resources. Do you have a password lock on here?
I do.
There you go.
I want that. Thanks.
So maybe explain, when you hit a trigger point, and it's like, whoa, that hurt, and I never even knew it. And so you hold that muscle, maybe you have a knot there, and release until it releases.
Yes.
Okay, so what are you doing? What is that doing to the body when that releases?
Well, there's some science behind it. I'm trained in neuromuscular as well, so I use that a lot, but other people will use different modalities to accomplish the same task. But the way I was taught, and I'm not 100% on this because,
the medical world isn't 100% exactly on what trigger points actually are.
So what happens? The mechanism is still kind of, it's a theory, right? We have a lot of theories. And so I like to disclaim that because I want to be able to change the way I think about it if there's new discoveries, right? So, but what I was taught with neuromuscular is that every, I think it's 18 seconds or something, the neuron sends a message to the brain telling it how long it should be. So when we stretch it for that length of time, in that window, a message is sent to the brain saying, this is how long this muscle is going to be. So it lengthens the muscle, releases the muscle. Right? That's one way of thinking about it. There are others, and they talked about some, and this was in a different paradigm of more of a chemical reaction that happens. So I honestly can say I'm not 100%. But I do know that direct pressure is one really effective way of releasing a trigger point in some cases. Because sometimes it's not good to release that trigger point. And we're going to talk about that when I talk about the safety. Okay, so if you hold a trigger point for a minute and it doesn't release, stop. So we're going to talk about that. Because that's important I use myself as an example. 3 days I couldn't walk because I didn't stop. I just was like, I'm going to get this muscle, and I learned the hard way what can happen when that muscle is actually protecting you. So, but we'll get to that. So this is a good question. There's other things that, like with percussion, that we're going to talk about when we do the self-care part on how this works, and just, yeah. Okay, so the first website I wanted to talk about is actually the second one on your form, and that is this really nifty website called triggerpoints.net. And I just like it. I don't use it very often because, again, I know a lot of the trigger points. But as far as if you were trying to find a trigger point and you knew your pain pattern, I thought this would be a really great resource for you. And I wanted to pull this up because I wanted to show you actually how to use the site. So this is where I'm gonna do. So I'm gonna step in front so I can show you guys. Okay.
Oh, yeah, that works better.
Yeah.
Look it up.
So I have this site, triggerpoints.net, and if you go, you can actually go to symptoms, and this is a little harder because you don't know all the medical jargon, but you can kind of irritable bowel, right? And there you go. Or if you had heel pain, so you just click on heel pain, and it will bring up these different spots. And so you can, let's say this is where your pain is. It goes back here, right? So then you can click on tibialis posterior, and then you can see where the trigger points are. This is the trigger point, okay? But the pain could be all the way down here. All right,
So the secondary pain is like the origin, kind of. Yes.
No, this might not even hurt. The trigger point might not even hurt.
Yeah, but it says secondary pain, so I'm assuming it's
secondary symptoms over here.
Symptoms I meant.
Yeah, so like this is.
Yeah.
Yeah, and then because sometimes it'll have more than one. Like especially in the jaw can affect so many different things in the head. And so some of the muscles in there are like, this is a little tiny muscle, right? So if you don't have this big, let's see how in the soleus, this is way up here. So you'll have pain here, but the trigger point's down here.
Does it show where the origin is?
Yeah, the origin of where you should, yeah, that's the axis.
Okay.
Yeah, well this may not be the origin, but that's where you can work.
Okay, because
yeah, because sometimes it's the joint, right? If the joint is unstable or something's jammed up, so you can have that. But why would you have that up here? See what I'm saying? Like it's an interesting site, and you can find all of these things here. Even shortness of breath, stitch in the side, right? Greatest anterior. Like that's pretty cool. And so you can go that way, or if you know what muscle you're looking for, you can go to this section, click on the muscle, oh, no. All right, well, gluteus maximus, I clicked on the wrong one. But you can see the trigger point, there's 3 for gluteus maximus, okay? And then, but minimus, which is what I was talking about with the referred pain down into the leg, you see? Like, so you could have pain down here. It's wild. It's just absolutely fascinating. And to see it work, especially with this one, actually not so much with this one, I think it's, which one is it? Piriformis, I wanted to show you.
Do latissimus dorsi afterwards.
Oh, latissimus dorsi?
Yes.
Okay. So, see, down into the arm, into the shoulder.
That's neat.
Yeah, so like, and then you would see the trigger points that I will talk to you about how to work safely, right? So these are all like fantastic resources. I'm gonna sit back over here for a second. Okay. But I wanted to show you how that looks, so that you would just be able to find it yourself.
So I have diaphragm pain.
Uh-huh.
Okay. So what would I look up on that?
So I'd probably go to the no, that's muscles. Abdominal pain.
Yes.
Is what I click on, and I go to the abdominal pain, and then you can see the pain patterns. I'm going to show you. Ugh. For intercostalis.
Okay, so it could be thoracic spine then.
It absolutely could, yeah.
So the thoracic spine could be affecting the whole diaphragm and digestive system.
It is amazing how much these things can affect. Right, exactly. And so the real question then is, what do you do
I've been
about it?
barking up the GI issues, and they said there's nothing wrong.
Right.
So they're just starting to look at the thoracic,
And
and I could have deterioration of the spine.
And yeah, exactly. So
And then you can't rule out the vagus nerve either, or the
Yes.
abdominal.
it is truly an investigation.
And it's related to the heart. The vagus nerve is related to the heart.
So there's so many things.
Well, I know many years ago, I was working and I was squatted down on the floor, putting coats and harnesses on preschool children. And a special needs child, ran across the room, jumped on my back. Couldn't think much about it. It's like, oh, I'm going to be sore tomorrow. It wasn't until I went to the grocery store, thank goodness I had a grocery cart, and my knees collapsed.
Where it's just
I
pain.
had 2 herniated discs. So the disc affected the knees.
Well, yeah. I mean,
For the pain,
or the pain. Yeah.
just
Pain wasn't all that bad. It really wasn't. I mean, because I've had back injuries before, and I dealt with it, and I'd iced.
Mhm.
I didn't go to the doctor right away. It wasn't until, oops, I can't walk.
Well,
Then
if
you're like,
it
oh.
hurt your core, then your legs wouldn't have that stability from the core anymore, and that's why your
Yeah,
legs
but I
would
had
have
to-
lost.
Yeah.
that could have been a
Herniated
different
disc.
kind of injury, because when we're looking at dermatomes, it's usually sensory, but if your legs stop working, if it's a motor issue, that could have been more like spinal cord, maybe.
Well, I mean,
Yeah.
it was because I had 2 herniated discs.
Yeah. Yeah. So
Well,
when we don't have the right, yeah.
So it wasn't. I didn't feel. I mean, I knew I was going to be sore.
Yeah.
But I didn't think I was hurt that bad. I finished out the rest of the day.
Mhm.
It wasn't until the next day that the knees gave out.
And it could be something like, because I've had people's knees give out when they've had issues in their thighs where they had trigger points that they didn't even know that they had. And then just their knee will buckle, right? And so there could have been any number of cascading effects, but you know what caused it.
I
You
knew
got
what-
it?
yes.
And so the mechanics of the mechanism of how that happened, the before and after kind of situation. When they fixed your back, did that fix your knees?
Well, he also blew both knees at the same time too. So, but initially, yes, after I had the fusion, it did help the knees. But then eventually, I had to have the knees replaced. So
Yeah, I think I remember that.
If something like that happened, how would you know if it was serious or not? Like, how would you know if the weather were event or not?
We're going to talk about that when we get to the
Hopefully without the
safety.
knees collapsing.
Yeah. Well, I think anytime that you have any kind of
motor issue.
motor issue or extreme pain or an injury like that, like especially
You could lose sensation in the dermatome or just any area.
or anything that this is why it's so important when somebody has a fall or an injury to stabilize their back. You don't want to just move them. You want to make sure that they're safe. Because we don't know what's happening on the inside. You could have a spot. I'm not going to say who it was, but somebody I know very well fell and broke their lumbar and walked all the way home. Did not know that they had a break, and it was like a compression fracture in one of their vertebrae, and so we don't always know unless we go to the doctor and get an X-ray. So that's why I'm like, if when in doubt, don't, and at least if you gotta go to the doctor to have a test done to make sure that you're not gonna really hurt yourself, then do it if you can. If there's a doctor that you can get into, because sometimes we have issues getting into a doctor.
or they misread the X-ray.
Right. So we do still want to try to make sure we don't die, or that's ultimately it's a good thing to do. I've gone to the emergency room many times because I thought I was having a heart attack because of the referred pain going down my arm and other health issues that I had, and it wasn't. It was a referred pain, and they made sure I wasn't dying. But they also made me feel crazy. So don't feel crazy. Just rule it out. And then at least you can move on knowing that you're not having a heart attack. But if you are having I had a lady came to see me and she was dizzy and I sent her to the emergency room because she had pain and other things going on, but she had a stroke. right? She was having a stroke and didn't go to the doctor. And so you do need to know when to go. And so like that's a fine line, right? That is hard.
Almost 2 years ago, I went to the emergency room back to back, and they said my EKG was fine. It wasn't fine.
Right. Because the test.
You know, and now that it's in limbo, but on the report that they wrote, they questioned whether I had a heart attack, and they released me as if nothing was wrong.
I know. Well, we have to at least do our due diligence to
I
try. Right, you try. You try to make sure.
I
Make
try.
sure. It's but anytime that you have to deal with any kind of spinal injury, I just think that's a good thing to make. Like I mean, you could have things you didn't even know was wrong, like a bone spur on your spine. You know what I mean? There's things that sometimes we need. It stopped working. I don't know what happened. Did you fix it? Sorry. Oh, did it turn off? Oh, okay, sorry. It's not my laptop,
That's
so I
why we
wasn't
had
sure.
children.
That is exactly it,
So
so I wasn't
It's
sure.
got a little button.
But these are good questions to know when you know you need help. And it's hard sometimes to identify that with smaller bones, especially with a break on a bone that like maybe you don't need to actually like you're gonna know when your wrist is broken usually, but the bones in the feet. I've seen athletes break a small bone in their foot.
But when a bone breaks in the wrist, you notice because you try to move it and it doesn't work. So
Well,
that's
not
why when you break
necessarily.
a bone in the back, you should try to move it.
No, don't
No.
try to move.
Oh, no. Okay.
Don't move your
Got
back. If you think you broke your back, don't do that. Make sure that there's things.
Okay.
But like for self care, I think you should know. Look at you guys. You don't make me laugh too much. Okay.
Just testing something out. It's fine.
Just making sure you're not broken over there.
I'm hearing some crack. I think it's
Mine cracks a lot too. A lot.
But
Something like
you
that.
should go ahead.
Sounds like
No, you gonna
a
say something? Okay. All right, we're getting back on this. Yeah. Okay, so that was the trigger points. Now I have another site called KenHub. Now I don't have a subscription, and you don't need a subscription to this, but you can get more access to videos on this site. But that's not what I'm not trying to sell you guys anything. You don't need to do that. I just like this because it's very thorough, and then it gives you a kind of an idea of what's happening. So I use this to find antagonist muscles. So like I just said, you have a problem here. Well, why do you even have that problem here? Whenever you deal with one side, you want to deal with the opposite side. Just always treat them as a unit. Think of it like a marriage, right? You're a team, and one does a very different job than the other, but both are affected. And so sometimes your wife starts grumbling because you didn't take out the trash. You're not doing your job. Now she's got to do the job. She's telling you that, right? So, yeah, you deal with the wife, but you also got to see what's going on with the husband. Why didn't he take the trash out? I'm just using that as an example, okay? I'm not trying to convict anyone about taking the trash out. I'm just saying. So, but you get the idea. So you have to treat the entirety of it because, that's just part of it. And when we talk about the actual self-care, then we will show it, we will go over that. So this is KenHub, and then I just go to the anatomy side of it. And you can, I'm gonna come over to you guys. Okay, so we have the anatomy side of it right here. And then you can search for the muscle, like you wanted to know about latissimus. How do you spell that? Oh, there it is. Okay, so then you come down to the articles, and this is all about this muscle. Now, I don't have a subscription, so I can't play the video, okay? But that's not the point. See, it has very, detailed, view of the muscle itself. It talks about the functions, where it attaches. This is more important for, kinesiotaping, but it's just a wealth of information. But what I really like is this. This is the section I like. It goes origin, insertion, the nerve. We're talking about the nerves. What innervates it? the blood supply and the functions, and this is really the important part here, the functions. So if I know that I have a trigger point in latissimus dorsi, and this controls arm internal rotation, adduction, extension, and assist in respiration. I didn't know it did that. Wow. Okay, I really did. I'm sorry. I learn something every day.
So,
Yeah.
do either one of these sites help you figure out how to prevent or how to strengthen that area?
Well, I don't think this one actually does have exercises for it, but that's a very good. You know what? I'll find a good site for exercise prescription, and I'll email or I'll send it to you both.
Okay.
Because that's a very good question.
So, what would I do for water aerobics? What could I do in the water?
To strengthen
I
the
can't
muscle.
do a lot on land. I can't do walking. I can't run.
So what can you do in the water?
What can I do in the water? And
Well,
is
with
there a
laps-
site with it that I could walk?
I mean, I don't swim.
Oh, I do
Just a little bit.
the aerobic exercise in the
Okay.
water.
So, well, it does to some degree because it tells you the action. So the action is going to be how you exercise.
Okay.
But ideally, with some of the exercises that like a PT would prescribe, they're really focusing because some of these muscles have multiple heads, they have multiple things. So what do we need that muscle to be doing in strengthening?
Right.
So I'll try to find you a site. A good PT though is also a good resource. I don't have any professional relationships with a PT, so I can't speak of any or refer you out. But
Well, then that was a problem. I went to a PT that had a pool. I knew more than they did.
so it was like, well, yeah.
So just go ahead and find a cheaper place to go and work it out myself.
Well, you know what? I'm being practical. This is self-care, right? A lot of things, if you're going to do it yourself, if you can do it yourself, then do it yourself.
But then I need help. What about, XYZ? Would this improve it? Not. I wasn't able to go to the pool for about a month. Man, orthopedically, I felt it.
Right. Well, the pool also is really weightless, so that helps in the joints itself too. There's so many things. I love swimming. I think it's great.
And but I do weights on the ankles.
In the water.
Give myself more resistance.
Gotcha.
It's gotten too easy.
Yeah.
So
then you just need to up it, but you can't. Do you not swim because you can't?
I don't know how.
Okay, well,
And I'm 70.
we gotta teach you how to swim. Alex, our next class is at the pool.
It's really fun.
All right, we're gonna do some stuff in the pool.
And the first class is if you don't swim, they just throw you in anyway.
I swim, I just don't like it.
Oh, you don't like swimming?
I can swim, I just don't like it.
Oh, gotcha. Okay. So I love swimming. I think it's a great exercise. I think it there's a lot of good there. But yeah, so I'll find a good resource for you. But the more that you learn about the anatomy, the more you're going to be able to just figure it out, because it is just levers. We are, at least the voluntary muscles of, that get us moving. It's just a lever. So if you know that this muscle is weak, right? Then you need to do some, what do you call them, curls? Like whatever, right? So your triceps, right? These different things.
Yeah, not just knowing anatomy, but if you want to strengthen the shoulder, just being aware of the movement that's available to the shoulder,
And we do have an
flexes
instructor
and
in this class.
extends.
Oh, good. Then they can
He
help
takes
with
us
some.
Rotations.
They take us through a routine.
Well, the only problem that I have, and this is my personal
They don't
preference.
know what our issues are.
There you go. Yeah, because they don't necessarily know how to accommodate you.
Well, it's a class. The other day we had 26 people. We all have different problems.
Right, so how are they going to do that? That's like a personal trainer might be a good option at some of the gyms. I know that in the class that I do, at least because it's adults and not kids, our instructor, there's only like 6 of us in the class, so he can really say, okay, you don't need to do that. You can do this or do it this way. Sometimes he still pushes us, but you're right. They don't necessarily know. But a good trainer on a one-on-one I actually do know a lady who's really good. She's in Hagerstown, so I don't know if that would really help you, but I haven't talked to her in a while. But she's very good. So, good questions. Okay, so, all right, what's that? Okay. Okay, all right, so now we are going to move on to safety first. When in doubt, don't. And when not in doubt, question. And I say that because sometimes we think we know. Oh, I'm sorry, I handed it out to the wrong person. Sometimes we think we know that we're safe, and we're actually not. So when in doubt, don't do it. Okay, ask somebody, go to somebody, but please don't hurt yourself. But even if you're not in doubt, question, is this going to hurt me?
So with not in doubt, doubt.
Oh, well, a little bit. A question.
When not
A question.
okay.
Question why you're not doubting. Why don't I doubt this? And I say this from personal experience because I've been a massage therapist for over 20 years. 20 years. And I've hurt myself within the last time. So like I know that this, not hurt myself where it was like catastrophic, I'm never going to move again, but that it made things worse. We don't want to make things worse for ourselves.
I had really good PT years and years and years ago. And, we always were told no pain, no gain. But she said that's not true in PT.
It doesn't have to be. You can actually have a lot of gain without having pain. I do tend to work on the harder side. But
there's something to also experiencing some pain and gradually exposing yourself to it, because you can actually just be extra sensitive to pain. And so if you allow yourself to gradually get exposed to working through
You say spiciness.
working through pain, allowing yourself to become less sensitive to it.
yeah, there's a sensitization that happens. So some people, and we're going to talk about that when we talk about the hedonic level. Some people, we all experience pain differently. And so how can we increase that threshold before you are really like tapping out, I can't take this kind of thing. And we can do that with those things. So, okay, so when in doubt, question. All right, so I'm going to ask you, do you guys know what a contraindication is? So basically, when not to do something, like to work on yourself. Can you think of anything?
Well, if you're bleeding.
There you go. Well, that's a good one.
You see a broken bone.
Yeah, no, don't do that.
Sign of infections.
That's one that a lot of people overlook. When you have an active infection, you don't want to do a lot of body work that's going to move that lymph fluid around in your body, and you can make yourself very, very sick. The problem is sometimes we have an infection and don't know it. So you have to ask yourself some questions. Am I sick right now? Is this pain the start of the flu, or am I actually hurting? One common overlooked infection can happen in the joints, like a bursitis, something like that, where you can like have something going on and you just think it's the muscle. So sometimes you just want to take it easy and just ask yourself these questions. And then even if you work on yourself and it makes it worse, at least if you were aware, then you can say, okay, something else is going on. I need to do something differently, right? But yeah, people often say, oh, I'm not feeling good. Can you just rub my shoulders? Well, I don't think that's a good idea, right? Because we don't want to work too much on this. Right? Okay, other contraindications. Anything that you guys can think of?
A hot spot?
Hot spot? You mean like?
It is an infection and it's a hot spot.
Like actual heat?
Like actual heat.
Mm-hmm, yes. That's,
that area may be
hot
and red and touch.
Because you could also have like deep vein thrombosis,
right?
You can have that hot area, right? So you do want to be aware of those. What you have?
What are contradictions?
Oh, contraindications. So it's an indication that is contrary to what you should be doing. You should not do this if these things are happening.
Okay.
Because we don't want to hurt ourselves more And I've seen that happen. So you have an injury, like people think heat. Just put heat on it. Oh, so many, you know what I'm talking about, right?
Yeah.
And if you bring heat into something that's already inflamed, you can make that so much worse, especially if it's on the, in the vertebra, right? So you twist your back and you put a heat pack on and you leave it on, which you're not supposed to do anyway. 15 minutes on, at least, and then 15 minutes off. You don't want to leave it on. But if you do that and you bring all that heat, and that's good in some cases, but it can actually make that worse. Yeah, and so then you can have more pain. And so when to use ice versus heat, and you never want to leave that on. So if you have like something that's already inflamed, don't add a bunch of heat to it. I think that's a pretty good rule of thumb, right?
Yeah.
So when should you use heat?
To relax a muscle, like especially like after overworking it. I think that's a pretty good one.
When it feels good and helpful.
Yeah.
When
I
you're
was-
cold,
When you're
I was always told
Yes.
first 24 to 48 hours after an injury, always use cold.
And I would
And not
say,
necessarily ice, but cold.
yeah, I would lean towards ice in an injury, or I'll tell people on the joint or something. But you could maybe, if you had a secondary compensation muscle that we're going to talk about with the both sides. You could, if this is sore because this is injured, ice this, put some heat on this to relax it, to kind of soothe it. You can do that, but just be aware of what heat can do. It can
Cause more
exactly.
inflammation.
And you don't want to leave ice on either. You don't need to have
You can get burned from ice.
exactly. And so
Well, and I think ice is appropriate to help with the pain in extreme situations, but right after an injury, inflammation is actually part of the healing process, so you don't want to ice and impede all of that inflammation because it's actually part of the healing process. The heat and the fluid that it brings in is everything starting to try and protect it and repair itself.
So that can be a little touchy.
Too.
Yeah, and I say touchy because sometimes there's a time and a place for everything, but at least looking at it as how can I not hurt myself, right? And just be careful with the heat. I'm trying to think if there's other things you want to be aware of. Medications you're taking. If you're on a medication and okay, you guys don't, but I know you want to pay attention to things that would thin your blood, right? If you're on a blood thinner. Well, that's pretty much the big one that I worry about. I mean, if you're
Well, even supplements can thin your blood.
exactly,
Like
if you can.
turmeric
Yeah.
can thin your blood. I just found this out. I didn't know this. Frankincense is a blood thinner.
So things that we don't even recognize
Not
as a
a
medication.
chemical, it comes from nature, but it still has a tendency to thin your blood.
So there's.
It doesn't make you unsafe to work on, but
No.
you probably want to watch how much pressure you apply.
Right.
Medical conditions, osteoporosis. You're going to want to be more aware if somebody has weak bones. Or if you suffer from, I have a family member who has a genetic disorder and basically makes their ligaments loose. So you don't want to do a bunch of stretching and stuff. So you just have to be aware of your body. We talked about somatic awareness. That's about being aware of what's happening inside yourself and your limitations, right? Because mine are different than everyone here. So, okay, so those are some common contraindications and the questions to ask before you work on yourself. So I guess we'll move into the actual work. Okay, so this is the application of everything we talked about. Okay, so we talked about, well, let me ask you guys, if you were if you were in pain and you knew where the trigger point is, because you found it based on whatever, how are you going to affect the trigger point?
a hammer.
With a hammer.
Depends.
Sort of, sometimes. Sort of. Okay, maybe.
Like a chisel and a hammer.
Just a chisel, yeah. No.
Oh, God.
Okay, so what would you do?
Is Press on it for 20 seconds.
Press it, rub it,
Rub it.
squeeze
Okay.
it.
So when I on this list I have, and we're gonna go over each of them. Direct pressure, pinching pressure, petrissage, which is that rubbing and kneading kind of thing. Stretching, ice and heat, which we talked about. Percussion with a percussive massager and kinesiotape. But we're not gonna go into kinesiotape because that is I'll do a class on that later if you guys are interested or if I have people want to know. So, and the percussive massager, I don't use this one here, but this is one I have at home because I can just take it with me. But the one I have here is a little different. You guys know it. But Alex is the same one that, so I'm going to show you how to use it. Did you figure out how to use it?
Not yet.
Well, this is why I brought this one so I could show you what I mean by this and how to use it safely. So direct pressure, we kind of already talked about. You hold it that 20 seconds. You could maybe do it a little bit longer, but I mean,
Not to do 30, but that's.
Yeah, I wouldn't go more than a minute. And so, talking about safety, I forgot to go over this. Sorry, guys. When you start to work on one of these trigger points or any muscle, if you don't have some improvement within a minute, I'm not saying it has to be done, but where it just is not getting any better, stop. Because it's probably and I shouldn't say probably, but there's a chance that it is actually protecting you. It's maybe stabilizing the joint or some other thing that could be happening, And if you overwork and you force it to relax because you can trick it, you could put cream on it or, like something that would relax it or take, whatever. I've had people go and get the cortisone injections in the muscle that was spasming and then had secondary, like a lot of pain, worse than before, because those muscles, even though they were a problem, were actually doing something else. And they needed to be doing that job. Okay? So we need to pay attention to that. So if you don't feel any relief, move on or look at it differently. Because it might not be a trigger point, it may be a joint. So let's say we do the direct pressure on your quads, right? And she was actually showing me today this, and I never thought to do this. It was just really smart. Direct pressure with your arm on it. Now, a lot of times I will use my thumb or my fist, the palm of my hand, but this is actually kind of nice. And I was like, that actually works really great.
The
So,
elbow works really well.
yeah, and she was
too.
doing, right, and the elbow. So
So
just
you can actually do more pressure.
yeah, and then you can lean on it, and you're not hurting your hands, because, well, my hands hurt a lot. So you can lean on that, and let's say it just doesn't feel any better, okay? It's not getting any better, and I see this more like with the ankle, especially with the ankle, with the calves. It might be that the joint itself is compromised. So I could work on your gastrocnemius, and it's just not letting up. Like you got the Charlie, actually I'm going to use this as an example. We do some stretches and exercises before class to stretch out your ankle. And then if you don't, and like let's say you're jumping around, you're doing some jumping jacks or whatever, you impact, and something's just not quite right, then this muscle can then tighten up. And so no matter what you do, it's not going to relax. And this is when I first experienced muscle cramps. Like, have you guys had muscle cramps before? I've never had a muscle cramp before, except for like the stitch in your side. That was like the extent of, I was like, wow. I have newfound appreciation for muscle cramps because this really hurt. And there was nothing I could do until I figured out that my ankle was locked up. And so that's when I started really joint lobing my own ankle and stretching to try to get that freed up so that my calf would relax. So if I had kept working this, I might have bruised myself. It might have felt good during, but it wasn't going to fix it. It was just going to continue to be a problem. So if it doesn't change with a minute's of pressure, then move on to something else.
If you were speaking of the calf, another example, it might be a far-fetched example, but when my sciatic is acting up, I might feel it in my butt and nowhere else, but might get pain in my calf and work on my calf, but then all of a sudden the pain gets more like widespread. It doesn't get any better. It just feels worse. Is usually when I know it's the sciatic nerve that's causing it. So working on the calf doesn't help. That's an example.
But doesn't mean that you're not doing it right, or that the pain isn't there. So we scrap it. It's an investigation. You tried. You ruled it out. So anything that doesn't work just gives you more information on what it isn't.
Good on
Right?
this.
So just go down on the list, right? The beauty of your body, I mean, there's a lot of parts, but typically there's things that it can be. You can start to rule things out, which is helpful. So the direct pressure, right? We were talking about that. Pinching pressure. What if it's in your abdomen, right? Or like right here. This is a big one in your traps. A lot of people have stress here. So pinching pressure. You're pinching. So instead of using the bone as the counter pressure, you're just pinching it together. So, and I wanted to show you this a little bit because sometimes we think it needs to hurt, right? So, and we're going to talk about that with the traps. So what you want to do is find the trigger point and you squeeze to what is called the hedonic level, which is where any more would hurt bad, but it does a little hurt. It hurts good. So you want to stay there. And then you hold. And then in 20 seconds, like mine's already released. Like it's already fine. I should do that more often actually. I need to do that. So if you can't quite push down into the bone, then you can pinch it together. And the same is true for a muscle cramp. So you get a muscle cramp and you do this. You don't actually have to do that. Push together, and it serves the same purpose. And instead of with neuromuscular, you're basically taking the muscle and you're stretching it because now you're pushing down. Now it's not just this short A and B. It's A, B, C. So it's actually longer, like as if you were stretching your calf, right?
Yeah, like what you just said. I mean, I read somewhere that when you have muscle cramp, just stretch the muscle, and that muscle cramp will go away.
And it might, but it can be very painful. This is why I'm showing you a nicer way to do it where it doesn't hurt as bad. Because pushing it together does the same, will trigger some of the same responses because it tricks it into thinking if it's a joint. Okay, so if it's a joint, I can trick it into thinking that there's support there, or just lengthening the muscle by pinching it together. Does that make sense?
But you also, with muscle spasm, you do need to check your magnesium.
Yes, that is
That
very
is
good.
probably the number one cause of muscle spasm.
And I think potassium. Yeah. So
And we're very deficient in both of those because of our diets and the way food is raised today.
Yeah.
I didn't even know that.
So
Just
magnesium and potassium are very, very important.
Right.
I think spinach.
I need more magnesium.
Well,
Well, the
I
problem
said
is, but it depends on how old that food is.
Mhm.
Even if you have fresh spinach,
Right.
if it's 2 months old, it's not going to have much of the nutrients left. If it's coming from California or it's coming from Brazil,
And by the time you
by
actually
the time
get
we get it,
yeah.
it's zapped. So raise your own if you can. Buy local when you can.
right, the farm market. I can't have a garden. I got too many critters around. I'm just
Well,
anyway,
actually, greens you can do in pots. They do really
I was actually
well.
thinking about doing that,
They
like a
do
hanging
really.
pot.
You could hang them too. Yeah.
Then I won't have to bend over. Anyway, yeah. So there's options, and there's also magnesium oil.
Mm-hmm. And I've used that.
And I that's
Good
really good
massage
for
oil.
there's some really good stuff there. So there's anything else on pinching pressure?
You mentioned it for places that you can't really put a lot of direct pressure on, like up at your shoulder. It might be easier to pinch than put direct pressure on, but I find some places where I maybe could put direct pressure on, if they're really sensitive, feel better when I pinch them.
Good point. Yeah. So you could do that because you could do it here, but you could also, if
You
you
could
wanted
also
to,
pinch it. Yeah.
So and that might be helpful for like weird spots too. 'Cause you're gonna, can you
I
get?
have a really cool. It's really hard. It's a little ball,
Mhm.
and it is great for trigger pointing.
Well, because you can just
I can lean up against a wall
yeah. Exactly.
and run it up and down the wall. I can use it on the feet. I don't have as much strength in my hands.
But you can read it on it.
But yeah, you can.
Yeah.
And it's easier actually to trigger point an area. So.
I actually have a little stone that is used for like a scraping technique, and it's anything that you can use that would get in there that would save your thumbs.
Mm-hmm.
Just be careful if it's not your finger because you don't have any sensation here. And so if you're doing it on yourself, it's probably a little safer because you can feel the other end. But for me, working on somebody, I have to be very careful when using this because I can't like feel what's happening underneath of it in the same way. So yeah, definitely. Ice in a frozen Dixie cup. If you wanted to put ice directly on something, you could use that.
And PTs use that.
Yeah,
And
yeah,
they have for years.
right. It's simple. You can put them in there. Just be careful if you do that because when you tear the edge off, and I've done this before, if you don't melt the edge, it's very sharp. So if you, yeah, you know what I'm talking about. She knows. Okay, so yeah, you can read about the mechanics and the mechanism, the science behind this, but again, like we talked, there's not always a clear mechanism.
No, but there's a lot of research, the points, when you talk about mechanisms, we're talking about working out muscle pain, but there's also research that shows that it's the nerve endings in the skin that are affecting the muscle. We're actually affecting it just at the skin level. So I could put pressure on a trigger point. I often find relief from that, but if I don't, moving it in a circular motion. So taking that point of pressure, but then stretching it in all directions.
I can't remember. I know what you're talking about.
Yeah, the mechanism isn't necessarily working a knot out of the muscle or releasing it, but sending new information to the nerve endings, something that feels good, and safety signals that's actually sending to the brain, which then tells those nerve endings to relax. Because muscles don't just stay tense or cramped up on their own. It's the nerves, it's the information that's being fed to them
repeatedly. Yeah, repeatedly.
What about stabilizing and taping? I know you're going to get into the taping later, but just even the elastic wraps or.
Oh, you're talking about. I thought you were talking about the exercises with the resistance bands.
No, say you've sprained your ankle.
Yeah.
Okay, so you've iced it, you've treated it, you've trigger pointed it, you're staying off of it. Mm-hmm. Okay, when does when do you brace and when do you not brace?
Well, I personally, it would take a lot for me to brace something completely. Because I want you to be able to move. Movement is very important in the healing process, in my opinion. When you get cinched down, I've seen people post-op for a rotator cuff injury, and then they don't do their movements, and next thing you know,
they're going to frozen shoulder.
Yeah, and so we really want to be able to move, because then you also are compensating. If your ankle's completely, restricted, you're going to walk different. So all the muscles in the rest of your body are now going to have to compensate. Mm-hmm. And this goes back to the referred pain because now all these other muscles are compensating for this. This may not even hurt anymore. Not this, but the ankle may not even hurt anymore. But now these other muscles have compromised themselves to accommodate that restriction. So if you can use kinesio tape or a different method to stabilize without completely immobilizing. Now, obviously, your physician would have to make that recommendation if it was like an injury, a tear, or surgery, or something like that. But if you can do it without it, but I think we had a slightly different perspective on that because we've worked with a lot of athletes, and so they can't always stop training. So how can we help them train safely within the scope of what we're doing in conjunction with their sports physician? You know what I'm saying? So, but that's my opinion, and that's something that, you know, like, are you going to hurt yourself more if that's not braced? Depends on the situation. If I had to do something really heavy, and I really don't like to brace my back, but if I had to do something, I really want to make sure that I'm safe, I'm going to put that back brace on. Does that make sense? But temporarily. I think movement is just critical. Everything that we see, not everything, but a lot of what I see as far as muscle pain, and dysfunction comes from what I'm seeing is lack of movement, and that's the result. So why would I want to keep you in a place of immobility, right?
Is that right? Yeah. It might be if it's not severe where you need a cast or a brace might help you just help it feel more safe and supported while you do move, because you do want to allow for movement still. The go-to treatment after an injury, they used to use the anagram RICE. Do you remember that? Rest, ice, compression, and then elevation.
Right, okay.
But they don't, there's new information out, so they don't use that anymore. They changed it to MEAT, which stands for movement, exercise, and then analgesics, like ibuprofen, Tylenol, anti-inflammatories, and then treatment. So they say after an injury, you should start moving it as soon as possible within like an allowable amount of like pain or comfort. So movement could just be as simple as like moving it through a range of motion. And then when that's fine and you can actually start adding a load to it or weight or pressure, you want to start exercising it as soon as possible within your comfort zone to help during the healing process. So you don't want to rest and wait.
You get really sedentary.
Well, and then when they do spine surgery now, they usually want within a couple of hours.
Because they want, you know, to move. It's amazing how things can change so quickly. That's why I like to say the theory pending further, you know, information, because we're constantly getting new information about the body. And I mean, we've been studying it for. We still don't know so much about the lymphatic system, the endocrine system. There's just a lot there.
So let me ask you a really tough question.
Okay.
How do you find a physician who will help you walk through this challenge? Is there an answer?
Honestly, pray. Like, I know that sounds kind of simple-minded, but everybody needs something different. And somebody could go into the same medical school as somebody else, but that one doctor knows something that you need. And so I'm not going to diminish one or another, because I really believe that they have something to offer do you know, you see what I'm saying? And so, and it's the same with massage therapists, like, sometimes what you need would be better provided by this person over here versus that. You know, it's about finding the right fit for you. And I truly believe that, I mean, because I'm a believer, I truly believe that the Lord will lead you to the right provider, whether that's a physician or a chiropractor or a PT or whatever you need. At least that's my hope and my faith. So that looking for somebody that has a holistic approach. If you have a complicated set of symptoms, looking for somebody that looks more into the holistic approach of your entirety of your body, that might be better for you. But if you know for a fact that I have X, Y, and Z wrong with my heart, by all means go to the cardiologist. You know what I'm saying? Like, it's just, it can be, it needs to be individualized. So and when you do find a provider, finding a network of providers that will work together, I think is the ideal approach, because doctors don't have time to work on your muscles. PTs don't necessarily have time to do this, but they can show you how to exercise. You know what I'm saying, right? Everybody has, it's what do you need, and going to the right person. That's just hard. It's hard. So,
And that's what I'm on this, it's not experimental heart medicine, but it's a new one. And I've had some issues, and that's what I told them. I said, years ago, when I was in an accident, I had a team here in Martinsburg, and they worked together, and they talked every week. So we had a orthopedic surgeon, a PT team. We had mental health and biofeedback, relaxation, teaching those skills. And we had a general practitioner. So that worked when there was a complicated case.
Right.
Now it's so fragmented.
and yeah, this is,
And nobody knows anything about anything else, and they're treating, the heart here, but they're treating, the kidney someplace else, and they're teaching, and you can't get into GI. I mean, just in the last 2-3 weeks, I found out that the spine has something to do with GI issues, and I never knew that.
so then you have to really be your own advocate.
Yeah,
And that's hard too,
because they think I'm crazy.
But you're not. And so you just got to own that they're going to think this, and be your own advocate, and don't, or have an advocate with you. Because some people just are not confrontational enough, even though I don't think it should be a confrontation, but just even saying, I don't think that's what it is, to a physician that knows better, and says, if you don't have that advocate there with you to speak for you, that can be very difficult, especially with minors or with the elderly that might not have the mental capacity. So take somebody with you, if you feel like you're going to get railroaded, and have them, be your little pit bull. Sorry, I shouldn't say pit bull, because it's just a dog. Yeah. Lots of dogs should be protected. Chihuahua, that's right.
Yeah.
That's right.
Yeah.
My emotional support Chihuahua.
Emotional support person. Sorry, I think
Yes.
it's
He's gonna bark and you're gonna
Yes,
listen.
exactly. So that's a good question. All right, so let's get back on here. We're gonna go forever. So stretching. We talked about stretching.
Love stretching.
Yes, I know you like the stretching. If it's a joint issue and we need to mobilize the joint, you've done the trigger points, that's not really helping it. Sometimes stretching the joint in all of its ranges of motion is going to help, because it's going to free it up. If you have somebody who can do joint mobilization, that's great, but can you do it yourself? So there's lots of videos on YouTube on different stretches. Find one that works for you. Once you know which muscles you need, that's why I showed you the kinesiology website, because if you know that your trigger point is in X muscle, then you can do the stretches for both that muscle and the opposing muscles and the rest of the range of motion for that joint. So stretch. I'm all about the stretching. I don't do it nearly enough, but it really can help. Being aware of when that is locked out, if it's your ankle, if it's your wrist, like, do you have restricted range of motion? If you stretch every day and do a little bit of a little exercise every day and do a little stretching, you're going to start to, like, one of the big ones for me is right back here. That's where just the movement, doing a range of motion, and you can start to tell where you have a restricted range of motion, and that's where you're going to want to stretch and look at the muscles in that group. So being aware of your body again, and range of motions, we could probably do a whole little thing on just that. Because if you go through a protocol on yourself where you're on range of motion, walking, your arms, your wrists, supination, your neck, and all of those. And you do this in front of a mirror or videotape it. Then you can watch and see where your restriction is, and then you'll know which joints to stretch out. And then it's just like with, and I'll try to find the exercise resource for you, and I'll try to send that out to you too. But
Yeah, the YouTube channel that helps me with stretching is called Movement by David. And that's
I think you sent me one of those videos, yeah. So maybe I'll send you that one because I like them too. So
Do you
YouTube is
use
amazing.
reflexology?
What's that?
Do you use reflexology?
I don't normally, but I am trained in it. Honestly, I typically will use reflexology when somebody has, but it's helpful in like finding an area that's an issue because I'll be rubbing someone's foot and they'll come off the table when I touch, a point that corresponds with the kidney, and come to find out they have a kidney issue or stuff like that. So that's really helpful too.
what is reflexology?
Oh, you don't know what reflexology is?
I brought my book because I thought you might go over it.
Yeah, reflexology, I don't actually do a lot of it per se, but it is a modality that focuses on the feet and the hands usually, more on the feet. And just like there's I showed you gave you the chart with the organ referred pain, then you also see a pattern of that in the feet. And so you can massage, that's the theory behind it, is massaging different parts of that will affect the internal organs. But since we were focusing more on myofascial trigger points, that's why I was more focused on the musculature of, those trigger points. Because that's going to be different. That's
So this is totally different than what you guys
it's
do.
totally different. It's energetic based, even though I think there's a neurological basis for it. I would say that's about right. I think that there's a mechanism that maybe we haven't completely understood yet, because I do see a consistency in it when I have used it. When I work with somebody who has an active infection or has like kidney failure or something like that, where we can't do body work, I can usually do some reflexology and not have to compromise their lymph system, that we can't do. But even that, they have pressure points in the reflexology for the spine and different body parts. So there is that. But I have to wonder if, because it's the feet, and this is one theory I had when I was training in reflexology, is the way that you walk when these areas are compromised could be what is causing the trigger point in that area. So then I thought about, I have lots of thoughts, okay? But I don't fully understand the mechanisms for it. So, but yeah, so did that give you any idea what that was, Alex?
Yeah.
What you looked at? Okay. So, so ice and heat we talked about, I think, already. Now we'll move on to percussion. Okay, so this is the percussor that I just picked up because my other one broke, and the one industrial therapeutic one is here, so this is just for home. And the reason that this is helpful is that it goes up and down. You probably can't see it in the video, but it's not going side to side. It goes up and down. This one's a little, I liked it because it was cordless. You charge it, but then it can lose the charge. So there's that problem too. But if you're just using it at home, just find the trigger point, put it on the trigger point, hold it. You don't have to put a lot of pressure on it. Okay, just put it on there. You can use it on your hip if you can kind of get off the side. Do not put this on a bone, on a joint directly, on your neck,
On your spine.
on your spine. Okay, only put it on meaty parts of your body. Okay, and when I use it, I do it a little different because I know what I'm. Huh?
Not over organs either.
Yeah, you don't want to put it over your organs, over your kidneys. Just on knee muscles. And I've had people who've had a lot of knee weakness, and they've had trigger points here, but it was a chronic thing caused by a medical condition. It was nothing they were ever going to do. So they would come in and see me every week, twice a week, for 15 minutes, And I was like, look, get one of these and just do this and kick, right? Just do the movement with it. And they didn't need to see me as often. Not that I didn't like seeing them, but that was just, it was not necessary. So when you add movement to pressure or percussion, or even like, well, I don't know so much about like massaging, like the rubbing, but if you have direct pressure on the trigger point and then add the movement, it's actually going to help that trigger point.
So does that
Release.
increase the blood flow then too?
What, the percussion? Oh yeah. Oh yes. Yes, it's amazing. I really like this thing. But not everybody likes it. Some people really hate percussion. So if you hate percussion, then don't use it. But for me, I like it, except not on the bottom of my feet because it tickles.
Yeah, don't use it if it tickles.
Yeah, if it tickles, we've established certain areas you definitely don't want to. But on the hip, because I have a lot of hip problems, a minute on my hip and the referred pain into my leg goes away. And so very fast, and I don't have to hurt my hands. And I like that, especially if you're really muscular. That can be easier to get through the tissue than trying to dig through the top muscle or move it out of the way. So it's not for everybody though. This one is not super expensive, but you definitely want one that is percussion and not vibration. Vibration goes side to side. This is going to go up and down. Okay. And is there any other contraindications that you can think of? Well, those are the big ones, right? Mm-hmm. Don't put it on your face. Don't do that. Like, I mean,
No eyes. It doesn't make them feel better.
No.
All it does is make you see something you don't want to see.
Yeah, don't do that. Right. Use some common sense. If it hurts, don't do it. I mean, if it hurts, bad. So.
Don't put it on plans.
And then the last that I wanted to go through was kinesio tape, because kinesio tape, I just love it, and we're gonna do that. That's just a little much, but you can, if you know what muscle it is, you can Google or YouTube the kinesio taping, and that's why I like the kinesiology site that I showed you, because it has the origin and the insertion. And with kinesio tape, you really want to know where the muscle is on the body, so you can make sure you put it in the right spot, and that would help you to find that. Now, if I ever do the kinesio taping class, then we can talk about that more. But I love kinesio tape. You know I like it. I use it for
Very few
everything.
people use it.
I love
I
it.
mean, in the past.
Yeah.
I don't know, it was rare that they would tape.
It's so amazing when it works. You're
Yeah,
like,
they would rather put a whole ace bandage around your leg.
but see, you can get the same kind of you can get some support without destroying all of the mobility, and that I think is really helpful. So you can exercise without being in a lot of pain, because people.
Well, they've been using it in sports for years,
Right.
But not the general population.
But you can, I think everyone should have kinesio tape, and they make the best band-aids for your fingers. I always cut my hands, so I use that all the time. Yeah. I have paint tape everywhere. It's ridiculous. Okay, so that's pretty much it. I mean, did you guys get anything out of the trigger points and how to work on them? Huh?
I think so.
Okay.
What's petrissage?
Oh, petrissage. That is like the massage term for like the rubbing, the kneading kind of.
Instead of putting pressure on the muscles if they hurt, I could like squeeze and rub them like
The
this.
circular motion thing.
Yeah.
Squeezing and circling.
When you think of regular massage, how that's
pushes and pulls
Yeah.
and twists.
I think its origin goes into kneading. Like, I think that's where the word comes from in Latin or Greek or something.
Yeah,
To kneading dough. You know how you would do that? It's the same kind of movement. Obviously, that was it. Just rubbing yourself. But that's just a fancy word.
Mm-hmm.
So, any questions at all on how to use the online resources or anything else?
I think you covered it pretty well. You might need to actually put images on videos since you didn't see it at all.
I was gonna recommend that to her.
Yeah, when I edit,
edit it.
I'll add it in
All
at
right.
the end. I can put a screenshot in video at the end. So if you
Editing
can have it.
is cool.
And, you want to do it for me? Yeah, no, I think this is a good
I
project.
thought you wanted to learn how to edit.
Yes.
Okay, all right. Well, we're gonna wrap
Download
this up.
DaVinci Resolve.
Okay.
No,
I will,
DaVinci Resolve is a
Don't
free one.
use
I
it.
haven't
Really good.
Okay. Yes, that's it. All right.
So
Okay.
are we talking? Are we
I'm
still
gonna done. I'm
recording?
gonna stop
That's
recording.
it.
All right, we're done.
Bye.
We're done. Oh yeah, everyone say bye.
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 We all over the top. Okay.
Yay.
That's
Bye.
it. Okay.